integrative health and fitness education. Welcome to this edition of Insider. Hope you're having a great Monday. Hope your week started off well. In this series, we've been discussing balance, so I want to share three things with you. Number one, we've been discussing balance in the last two episodes of this edition, or I should say this series. We've discussed the foot. So make sure you go back and watch those, because those will discuss how the foot is key. It's the foundation of our body to the ground. It's where the nervous system picks up a lot of the information about posture, movement, and balance control, because the foot is sending back lots of proprioceptive signals about load, speed, momentum, and then makes those decisions, the nervous system makes decisions based upon the information from the foot back to change and alter, modify posture and movement, ultimately balance as well. Today we're moving up to the knee, and then we'll continue next time, Saturday, with the hip as well. Now, you may ask, how does the knee relate to balance? Think about your clients that have balance issues, especially your older clients. If you watch many of them walk, they don't actually rotate anymore. They've lost rotation, especially many of your older clients. Older is relative, because even many of our younger clients, younger, like around 40 and 50 years of age, now that I'm 50, I say younger, but many of our clients have lost the ability to rotate. So when we walk, walking is essentially rotation. Is you rotate and then you counter-rotate. It's basically a rotation, counter-rotation type of movement. But when you lose rotation, you have to make up for it in another plane of motion. So what you'll see a lot of our clients do, I'll face away from the camera, is they actually do what I call a Weeble Wobble walk. Weeble to the side and wobble to the other side. They'll weeble to one side, wobble to the other side. Essentially, they're shifting their center of mass, which is somewhere around here, depending on your own body type. But these individuals are shifting their center of mass over top their base of support, because they know that they can't support themselves here and create that proper rotation. So what they do is they shift their whole entire body weight over to the side, and then they have to thrust it back to the other side. So it becomes a very Weeble Wobble type of walking gait, or listing type of walking pattern. So if you watch my feet, hopefully you can see my feet. When you walk, your feet should be relatively, again, not perfectly straight. They're turned out probably a little tiny bit, a few degrees, but they should be relatively straight, so that when you walk, your feet you roll off your foot. You keep the foot tripod. You're able to push off the big toe and little toe, small toe, relatively equal as you push off. But what happens is if you start moving more through that frontal plane like this, you will quickly lose your balance, because all your center of mass is starting to shift that direction. And if your foot is straight, you quite often, especially as you get stiffer, more rigid, and less reactive, as many of our older clients do, your likelihood is to keep going that direction. So how do these clients compensate for that? Well, what they do is they start to turn their tibia from the knee out. So now they start walking like this, because now this is much more stable with the foot turned out to catch my Weeble Wobble sort of gait pattern. And then what happens is, well, now they develop more knee problems, because now the foot's going that direction, but the knee and the body momentum is going that direction, and we call it valgus knee, but really it's a rotation of the knee. Because the knee is not a pure hinge joint, it actually rotates. So that rotation is so important, because it helps us control pronation. So when we load our leg, it helps us control this momentum right here and allows for it to happen, but it also helps to control it. We don't want the knee a complete hinge joint. We need that rotation. But what happens is our older clients will overly rotate from their knees, hence the reason they start walking like this and start tearing up their knees. I should say the turning out is actually a response to this sort of lateral type of gait pattern. So one of the things we can do to dramatically change balance and actually improve our clients' knees is to change how they're moving around their hip joint. So we use a specific pattern, and you've seen it many times here, but you haven't seen it in this manner, is we use the split stance hip hinge, because that pattern helps to improve, even though it's a sagittal plane dominant motion. Technically speaking, is sagittal plane dominant, it actually helps to restore rotation, because it actually helps to release the restrictions that are stopping the client from rotating, and that's typically the external hip rotators, as well as over-gripping from the glutes, which many of our older clients do, as well as many of our younger clients. And it also helps to start to align the hip, the knee, ankle, and foot, Because what we don't want to do with our clients that have these rotated tibias is just say, hey, push your knees out. Because what they do is they just push themselves to the outside of their feet, and they still don't align properly, because now they're changing their foot alignment. So what we actually want to do is help our clients set up the foot tripod, which is why we set that up in the last 2 episodes, and then teach them how to hip hinge while aligning the hip, knee, ankle, and foot complex. So essentially, once we've done our soft tissue release work to create the opportunity for better alignment, and we've done the activation work around the hip, knee, ankle, and foot complex to allow the individual to control their hip, knee, ankle, and foot alignment, now we'll teach them how to use it in the upright position, because it doesn't matter what you do with your client on the floor. Again, very valuable exercises lying down on the table or on the floor. However, we have to make sure that that translates to the upright position. So again, what we're going to do with the split stance hip hinge is start always with a head, neck, and thoraco-pelvic cylinder alignment. We're going to make sure that we put the foot down and then rotate the pelvis to the forward leg. So what we want to do is most of our clients put their foot down and then they put their leg back there, and then they're trying to straighten themselves up and they're contorting themselves. Make sure your client starts out well first. So what we want to do is, again, start with the foot on the ground first. So foot tripods, both sides. Align the head, neck, and thoraco-pelvic cylinder. Keep the pelvis square. Keep the entire cylinder square as you step back. Because even my young clients, my athletes, they will all step back and rotate this direction. I should say most of them will rotate. We want to make sure they stay squared up to that forward leg. So put the foot down first, align the thoraco-pelvic cylinder, second head and neck, and then make sure you stay squared up to that forward leg. And then it's basically just a hinge pattern. So you hinge and then come back up. So you hinge, come back up. From the side, it looks like this. Feet down, foot tripods set on the ground. Align the head and neck and thoraco-pelvic cylinder. Keep the pelvis square to the forward leg as you step back. And then it's a hinge. Try to keep the pelvis as close over top of the foot and ankle joint as possible. Maintain this alignment through the hinge pattern. I'll do a couple more reps from behind. So again, elongate the spine. Keep the thoraco-pelvic cylinder aligned and stacked. Make sure that when the individual brings their leg back, they're still squared up, because most clients will rotate this direction and then they're like this and they're wondering why their knee alignment never improves. So make sure that you align, keep that pelvis square to the forward leg, step back, keep that alignment, and then perform the hinge pattern. And really make sure the client stays squared up and doesn't rotate out this direction. They should stay square. They should feel it in their glute and hamstring and the external hip rotators of that forward leg. Hip, knee, ankle, and foot should be aligned, because that pattern ultimately becomes then your reverse lunge. Because from here, it's the same exact pattern. It's just a reverse lunge pattern that you start to set your clients up. And when you do that and help your client set that pattern up successfully, they will dramatically change their balance. They'll reduce stress upon their knee. They'll get better foot control. So it reinforces the optimal foot control, and you'll see dramatic and almost instantaneous changes in their balance. So between this exercise and the foot exercises I shared with you in the last 2 episodes of this series, you have a powerful strategy for helping your clients improve foot function, take stress off their knee, improve their hip function, and overall give them better balance. We're going to be teaching you much more of these strategies at our 1-day pre-conference for Fitness Fest that's coming up in about 3 weeks or so. We have a full-day conference. It's online, but it's going to be interactive just like this. I'm going to share this information with you. I'm going to share with you the anatomy, the biomechanics, and motor control, how the clients, or I should say, how we set up proper balance. I'll share with you the 3 strategies or systems that control balance. And then I'm going to take you through this exact assessment process, the corrective exercises, and then the functional progressions that we use with our own clients here in our clinic, that we use in our own workouts, and that we teach during our certification classes. So check that out. Mary will put the link next to this video or below this video, depending on where you're watching it. We look forward to seeing you there. Again, you're going to leave with strategies that you can use right away to create short-term as well as long-term changes in your client's posture, their balance, and ultimately how they feel and perform, which is ultimately what they come to you for. So thank you so much for watching this. If you have any questions, put it next to this video or below this video. I'll answer any questions that you have, except for what's wrong with me, because I don't know you. I want to know you, and I appreciate you being part of our community. But if you have any questions about the exercises we use and or exercises you do with your clients, feel free to let me know, and I'll be happy to answer them. Any questions about Fitness Fest, just reach out to Mary at helpdesk@fitnesseducationseminars.com, and she will get you all the answers that you need. So thank you so much for all you do for your community. Oh, also, I shot a video yesterday because one of the things that many of us struggle with in the industry is, are fitness professionals actually essential? And you know you're essential. I know you're essential. However, our clients and the community has a hard time understanding us as essential. Liquor stores, yeah, they're essential. Stores that sell junk food, yeah, they're essential. But somehow, fitness professionals aren't deemed essential. So I actually interviewed my personal medical doctor, my colleague, my friend, Dr. Fred Ettner. I put that on Facebook as well. Please watch that video. It's about 12 minutes in length. We shot it outside after we did our outdoor workout yesterday. So just pardon the wind noise and so forth. But listen to Dr. Fred Ettner's message, and please share it with your clients, because your clients need to hear this message, that they need to be taking control of their health now more than ever. And most of your clients understand that, but I hear lots of clients still like, oh, I'm going to wait till COVID is over. I'm like, you're going to be waiting a long time, and you don't think that something's coming right behind COVID. There's going to be something else right behind COVID. So make sure, really empower your clients to be proactive about their health. Give them strategies that they can use, whether they're training in the virtual world like many of our clients are still doing, or one-on-one or in small groups wherever you are at. Encourage them to be proactive. Dr. Ettner shares some strategies that he uses. He's 70 years of age, doesn't take any medications, never had a surgery in his life. So he practices what he preaches. So great message. It's very simple. It's very short. Share it with your clients. Like it and share it with your colleagues if you like it as well. So thanks so much for all you do. Thanks for being part of our community. And if there's anything we can do to support you during this time, please reach out and let us know. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. I'll catch you next time.